Dixie Street has always been a big focus of my life. My dad got me a paper route when I was 8 years old, and there were only about 4 paper routes in town at that time, and I had one of the 4. So my life was pretty well focused around Dixie Street.
I met my husband in 4th grade. We went all through school together and until we went off to college.
When I was growing up, we really didn't have a hospital in Carrollton at all.
We had a clinic here, just a very small clinic was all we had.
After the war, you know, with the Hill-Burton Fund established, there became an excitement in the community that we might actually have a hospital.
My husband's grandfather thought we needed a hospital desperately, so he saw a way to go ahead and give the first monies for the hospital, and then I think maybe Roy Richards came in and matched that, and a lot of the community came together to match that, and so they began the hospital.
Part of our relationship with the community goes back to our very beginning. Tanner Medical Center was started by a community fundraising drive by Mr. C.M. Tanner and by people in the community, kids even, bringing their nickels and quarters and dollars because they felt they wanted to have a hospital. It was a cornerstone of a great quality of life, cornerstone to good economic development.
Having had the luxury of being in this community for 38 years, I've obviously watched a lot of changes. This community has grown, and Tanner, of course, has grown with the community. And I think about the little, small, simple footprint of the hospital when we came in here in the early 70s, the expansion of Tanner Carrollton, literally the building of a new hospital in Villa Rica, the addition and renovation of the Bremen Hospital and then Willowbrook, and opportunities for Tanner to become an even bigger and more important piece of this community.
Back in the late 90s, our hospital in Bremen, the Higgins Hospital, served Harrison County, and we were in trouble.
We had a small hospital. It was run down with old equipment, and we were on the brink of going bankrupt, the hospital. And then Tanner came to our rescue.
It became quite evident quickly that we were going to have to do something if we were to keep our hospital on the hill.
We were a group of 4 or 5 family practitioners, and we had to do everything. We work many, many long hours, did all the surgery, deliver all the babies, fix all the bones, and when we finished, we've took care of the emergency room. We didn't even have an emergency room doctor, so it was a very, very busy time in our lives.
We started the process of trying to find someone to partner with us. After studying the different proposals that were sent to us, we quickly saw that our community wanted to partner with Tanner.
You can see what we have nowadays. I mean, we have a beautiful facility up here in Villa Rica.
If you've got good health care and good schools, you've got a good community, and we have both. So we are so fortunate that we have been able to maintain that, and Tanner certainly has been the resource that we needed to do that.
When I came here, most everyone was going to Atlanta, partly because there were not enough services here, and I think partly because there was still this mindset that all the smart people were in Atlanta somehow. I mean, for years after I came, I kept hearing, oh, we didn't realize you offered these services here in Carrollton. In fact, there are very few services we don't offer here in Carrollton now. You got to deliver the goods right up front. You have to show the patients you can deliver good care, compassionate care, and make them understand that they're not going to get better care elsewhere.
I'm originally from South Georgia, from a smaller town, Fitzgerald, Georgia. So my wife is from Douglas. So for us, we both wanted to move back to Georgia once we finished. But we also wanted a town that had a small town feel, a good place to raise a family. I have 3 kids. while at the same time offered the big city type of facilities that would be needed to do interventional cardiology.
You know, in terms of our interventional program, cardiac interventional program, one of the measures that we look at is door to balloon time, how quickly a patient gets their treatment when they come in and with their major heart attack, and how quickly is that artery open. I think that's a national benchmark, and we're very proud to say that we're doing quite well in that, in the top 10% in the country, where we're able to open the artery as quickly as we can.
We're forging ahead with quality as our primary parameter that we're looking for. We're looking for extremely competent doctors to bring on board, and we've been very fortunate to hire some extremely good people.
Once you have some of these people in place, these physicians in place, they act as a magnet, and it allows you to recruit other physicians to come in and help them or be ancillaries to what they do.
One of the things that we've enjoyed at Tanner Medical Center over the last 20 years is we've seen a significant growth in our medical staff. It's increased from about 100 physicians to now to over 300 physicians. And when we're selecting physicians, we try to answer one question that we think is very important, and that question is centered on, is this physician that we are considering, is this someone that we would take our own mother and father to, or take our children to?
We are their neighbors. I can't tell you how many times I may have gotten a phone call from a staff member at the hospital who is the next door neighbor to one of my patients, you know, calling me for them because it's their neighbor, not because it's what their job is. I mean, you know, we're here amongst the patients, you know, and so there's a commitment there.
I think it's one patient at a time. You take care of every single patient, and it's not in numbers, it's not in masses, it's truly one patient at a time.
The care you receive here is as good as you get in Atlanta or anywhere else.
One way that I feel that you can really sum up Tanner and what we're all about is that we're a mission-centered organization. I read the mission statement of Tanner Health System at least weekly. Sometimes in trying times I may read it daily. And I think that's important because that allows us to be grounded in what's important. And if it's not helping us fulfill our mission, which is essentially improving the healthcare services that our community has, then we have to really ask the question, should we be doing it?
Over the weekend, I was on call, and I had a 40-year-old gentleman come in with a massive heart attack, and was able to get the artery open, and he was actually discharged a couple of days later. To me, one of the things that makes it all worth it is seeing him walk out of the hospital with his family. There's nothing better than having somebody coming in with a life-threatening problem or with any problem, and them leaving after the care they've received better than when they came in. And to me, that's what it's all about.